ovulation. Dr. Nirmala, the question today that we want to talk about is, when people come in with obviously PCOD, how do you help them conceive? What do you do?
Yeah. The treatment for PCO again depends on, first of all, the category of patients who come to us. They could be a young girl, adolescent girl looking for only correction of her menses. So the treatment is in a different line. There could be somebody walking in for infertility. There could be somebody presenting with problems of excess bleeding and pain, etc. in the postmenopausal, perimenopausal women with PCO. So that line of treatment is entirely different. Well, somebody in the reproductive lifespan, the reproductive years, who's looking for a child. First of all, what we need to look into her is she obese? We have to estimate what's her BMI. And if she's on the obese side, we need to simply tell her that you have to shed that kilos. Unless the weight reduction is brought down, particularly a focused weight loss program, which involves loss of weight from the abdomen as well as the buttocks. As I told you in the earlier sessions, that there is an increase in fat deposition in central obesity, what we call. So it is this fat that we need to focus. So sometimes they say walking, I'm doing dieting. There is a specific diet. You have to cut down on calories, particularly the carbohydrate diet. So we have a schedule of dieting for them. And then exercises which focus on the abdominal area. Alright, because it is that fat which is the culprit. It is that fat which increases the insulin resistance and hence increases the secretion of male hormones in these patients. So it has to be like that. And the second subject is, we look into their periods, whether the cycles are regular or irregular, what is your hormonal status. If it is highly abnormal, we tend to prescribe them a tablet anti-diabetic medication called metformin. And that reduces the male hormone levels down. That's the first step, what we call as a pre-treatment. Subsequent to that, we start administering ovulation-inducing drugs. They are the medications in the form of tablets or in the form of injections, which increases the growth, maturity and release of the egg from the ovaries. Alright? And then we move ahead, because these medications are something which you cannot keep on taking it for your life. See, when you try on your own, you have a lifetime probability of achieving a pregnancy. But with these kind of medications, you have a restriction. You can't keep on giving them. So naturally, we tend to become a little more aggressive in them. Okay? So since you have a limitation on giving these medications for a longer period of time, so we give them a couple of cycles, we give them the medications, monitor them carefully whether there is an egg that is growing by an ultrasound, and then we time up their sexual activities, because that's a crucial thing. Timing of sexual activity when exactly the egg releases is very, very essential for one to conceive. That is something which misses the notice of many of the couples who are trying. And because the egg, once it is released into the fallopian tube, remains alive, remains in a fertilizable state for only about 24 hours. So that becomes a very critical time which is available. So we help them in timing up the time of sexual activity. And then we move ahead. If these techniques don't work, we go on to the next step, where we try to give them medications and we go and process the sperm sample of the husband, try to do what we call as an IUI. So that is done a couple of cycles, 2 or 3 cycles, before we move on to the last resort, which is the test tube baby cycle.
I see.
So these are the various modalities. So primarily, I would like to stress that when I talk about the weight loss, somebody need not lose weight to look like a model, because that puts them into a little scare and they run away. Okay, the doctor asked me to lose weight, so much weight. No, even 5 to 10% of the excess weight, even if they try to shed, the ovaries will start getting back into its regular cycle.
I see.
It really benefits them. So weight loss program with the diet, with all your exercises, lifestyle modification, with the medication, one could easily conceive.
I understand. As ever, doctor, extremely insightful. Thank you very much. Appreciate the insight. Thank you. You are listening to our weekly video cast from Little Baby Bump, a mom and baby center in BTM Layout, 2nd Stage, Bangalore. To find out more, please visit lilbabbymp.com or facebook.com/littlebabybump. Thank you.